welcome to everybody. Thank you very, very much for joining us today for this webinar. My name's Mike Bell. I'm the chair of NHS South West London, the Integrated Care Board for that part of the world. I'm also the chair of Lewisham and Greenwich Trust, which is in South East London. And I've been in similar roles, both in provider side and system side, for about 25 years within the NHS. Like many people that have been a long stay in the NHS, we've seen some of these things come and go round again and never quite get fixed. Hopefully today we can think differently, which is the title of the series, to make sure that we use the opportunities that are emerging from the 10-year plan to really build the transformation that will make a difference moving forward. Excuse me. These events are brought to you by Strasis, and they're a leading analytics and innovation agency. I first came across Strasis about a decade ago when I was chair of Croydon. I've been put there as a turnaround chair. We had many, many different consultancy companies crawling all over us, but we brought Strasis in, and they really did help us to think differently and set the trust and indeed the Croydon system on a road towards a more integrated and better performing system. Today we'll delve into how to develop high performing health systems across the country. The aim is to get leaders to think outside institutional boxes and think about the outcomes that we want to achieve. We've got speakers from integrated care boards, acute providers, international experts, and indeed from Strasis as well. You can see the full biographies of all of the speakers on the webpage. In terms of the format for today, each presenter will speak for approximately 7 minutes. We'll then take any immediate questions, but I will be quite ruthless in terms of not taking too many questions so that we can allow all the speakers to speak, and there will be a Q&A at the end of the meeting. But do put your questions in Q&A as we go along, because we will be looking into those, making sure that we're batching them and collecting all of the questions so that we can address as many as possible in that question and answer panel. I mentioned right at the beginning that this is potentially an exciting time. We have the NHS, the Department, Secretary of State, have launched the consultation on the future of the NHS and the work on the 10-year plan. We know that the government's intention within that is to look at the 3 shifts from hospital to community, from prevention, from treatment to prevention, and from analog to digital. But within that, comments have been welcomed from across the NHS, from staff, from patients, but also critically from the public. And there's been an unprecedented level of public engagement in that. For those of you who are working in the NHS, that probably feels a little bit distant from the day job, as you are dealing with both the operational pressures of winter, but also one of the toughest planning rounds that we've known in the NHS for many years. But let's stand back from that and think about how we might want to shape the future. I would suggest that our NHS systems at present and the work that we're doing on the operational plan is much more about managing demand than meeting need. And we need to move to a system which is actually focused upon addressing need rather than just the presenting symptoms. I'm not sure that we have a really clear picture of the outcomes that we're trying to achieve and what good looks like. And data availability across the NHS is highly inconsistent. We approach initiatives in silos. For example, the potential benefits of investing in one area to discontinue another. Our decision making tends to be made in isolation. Our failure to join up care drives costs, and it can lead to real potential harm. If I use the example of urinary tract infections, they account for around about 10% of all ambulance conveyances, and consequently around 10% of all GNA beds in our hospitals. There is no reason why many of those patients should be admitted to hospital. We do have the capacity to deliver intravenous antibiotics in the home, and we know that that will have longer-term benefits for the patient. They will not degenerate as in hospital, so their care costs will be less, and they'll be less likely to have things like falls. But that's a complicated series of actions to address that, with the ambulance service, acute hospitals, community, primary care, and social care all playing their part. But that feels like the sort of prize that we should be aiming for. So we want to focus today on practical solutions that place the people who really rely on these services at the centre and ensure that we're not just fixing what's broken, but building a healthier, more responsive future for everyone. System working isn't simply about integration and collaboration. It's about delivering a new mindset and skill set that encourages us to look beyond the walls of hospitals and buildings and instead consider the broad context of health and well-being. I'm asking my colleagues today to put aside their institutional interests and think broadly about how we can really make systems work.